Hello, I want to welcome you to another episode of Recovery Today, sponsored by the Recovery Resource Center here in Salisbury, Maryland. My name is Perry Gadurgis. I'm the host of this show. I'm a person in long-term recovery, and for me, that means I have not had a drink or a drug in over 40 years. I was also a person that was involved in the criminal justice system, and that was the spark plug in a large way that got me engaged into recovery all those decades ago. So I'm just super grateful to be part of this show, to be able to have the guests that we have. And I'm excited about today's guest is our mayor of Salisbury. That's Jake Day. And I want to welcome you to the show,
Thank
Jake.
you, Perry. Honored to be here.
Great. We were just chatting earlier. And why not right out the gate, what is your personal view about substance use disorder and co-occurring mental health and how that's being addressed here in Salisbury and maybe even nationally, but certainly here in our hometown?
Sure. I think medicine, society has caught up to medicine a little bit in that I think collectively we now recognize, and I'm speaking in generalities, but by and large, we recognize that there is a medical underlying basis that explains addiction, and that we have a fight on our hands that requires us to rely on medical knowledge and talent that is out there. But that doesn't absolve us of sort of the community effort that is also required, and personal responsibility, right? All these things, it's probably a 12-legged stool, right? But all of those things partnered together are how we create less of an environment of negative externalities as a result of the mental health conditions that exist, the lack of resources that have long existed to address them, and the consequences of addiction. We're obviously also in a place in America, and Salisbury's not unique, where that same medical industry, where healthcare, pharmaceutical industries have conspired, I believe, to get America addicted to drugs, and I think it's a fight that is going to be fought in the courts. It's a fight I think that's going to be won, and I think we will reduce opioid abuse in America. I think we're going to get there. It's just such a complex time. And I don't mean to speak in sort of a broad, inhuman sort of national policy terms, because I do want to bring it back down to our community and and myself and our family. But we're in this strange environment where a conversation about drugs, a conversation about alcohol, a conversation about addiction is in an environment where craft beer market is thriving, where marijuana is being legalized or at least decriminalized across the country, and where the pharmaceutical industry figured out how to get doctors to just push inordinate amounts of narcotics, of opioids, into consumers, and that's how they saw us. Frankly, they saw us all as consumers, right? And it's allowed for heroin to come back. And I say come back. There was a time when heroin was prevalent before. I don't want to say more prevalent. I don't have the facts and figures to support that. But when it was prevalent, and it decreased in popularity, and now it's back. And so it's such a complex time to be talking about this, but we're talking about it, and that's so meaningful. We're talking about it. As a community, as a society, we're saying this matters. And we're not saying, shame on the addict, shame on the individual. We're saying instead, let's create a better system. Let's be supportive. Let's acknowledge that those underlying mental health conditions that you mentioned, let's acknowledge that insurance companies haven't seen those as conditions that have parity with a physical disability. They have said That's not our problem. Where the medical industry has been ill prepared, where medical training, I mean, we're a relatively rural region, right? We're in an urban area, but a relatively rural region that struggles to attract psychologists and psychiatrists, and that is because we don't train them here. We don't train them right here. And so there's so many communities in America that have those same problems, the same deficiencies, a shortage of the mental health professional talent that is needed to support people and help them through crisis and help them, walk through life feeling healthy and feeling stable. And they deserve that. And we know that that there are professionals, psychiatrists, psychologists, social workers who can help with that.
Yeah, we know it's treatable.
It is totally treatable, as a physical ailment,
Yes.
Often is. So I'm glad we're talking about it. I'm glad we're looking at it through a lens that says we can do something about this. People are not disposable. We're going to support them. We're going to create a better environment for them to thrive, and we care about them thriving because it's better for society. It's better for all of us when the maximum number of people are engaged in society productively, and the only way to get there is to help them. And I think there's some models for how to get there. And I'm heartened that in this community we're having that same conversation in parallel. There are some things that we're a little slower on. There's some things that we're a little faster on. And I think all in all, we're doing a good job as a community to address it.
Well, let's dive into that then, a little more specific. A couple areas. One is I saw recently that you were at the local juvenile lock facility.
Yeah.
And I was kind of pleased to see that you were pleased or honored or there's a better word, that you left there wanting to come back, if I thought I read that
Absolutely.
right. And so what was that experience like? Because a high percentage of kids who are incarcerated have a substance use disorder or they come from a family of that.
So I'm going to make the assumption that most of your viewers have not been incarcerated as a juvenile. And so I'm just going to try to describe what I saw a little bit. This is not my first time there, but this was my first time in an intimate setting, having a sort of private conversation with the kids. You go through security, you go through multiple doors, and then you enter a space, a hallway, well-monitored hallway that, by the way, that has classrooms that rival or probably better than the classrooms in most of the schools that I walk in Wycomico County. Same with the cafeteria, same with the gym, same with the outdoor play areas, which is fantastic because I don't think any good comes from dehumanizing these kids and what they're experiencing based on whatever they did. No doubt in most cases they did something they shouldn't have done. But it doesn't help them get back to normal and get back to productivity and being a positive contributor to society to dehumanize them or take those things away. Instead, nurture, uplift, do everything we can to make things better for them. So then I got a classroom space with them, and in two groups, one with males and females and one with all males. And those groups were 15 or so kids. So I met with maybe 25, 30 kids. The conversations, I got about an hour with each. I explained to them some of the things that are important to me. Namely, I talked about youth development, our community centers, our athletics, our community gardens, our youth leadership programs, our civics council, and our youth summer employment programs, and why the city was investing in those things versus the conversation we were having 5 years ago about a curfew, and the direction we had gone, the sort of 180 we had done on kids in our community, meaning city government, not our whole community. I think our whole community's been right there with our kids, but city government. And so I talked about that. But then I just said, what questions do you have for me? Naturally, there was some shyness, some hesitancy, but as in each room somebody was willing to break the ice, we got to have really frank conversations about, well, why is there no Dave and Buster's? Why is why is there no arcade in the mall anymore? These are the things kids think about, right? There's nothing to do, and they recognize that idleness leads to, bad decisions, right? I was also able to say to them, look, I made bad decisions as a kid too. I remember at 16 years old, pushing over a porta potty and doing silly things like that, and things I shouldn't have done. And look, minor, but I remember making bad decisions, and I remember nights and moments when I could have gotten into a lot worse trouble. I could have done something far worse. That could have cost me my life. That could have, been reckless behind the wheel of a car, things like that. So, I think I recognize that you got to connect with these kids, and I connect with kids in high schools and schools around Salisbury all the time. But these are kids that are saying, "Hey, I'm in a moment in crisis. I maybe didn't choose to be here to have this captive audience, but I'm in a moment of crisis, and I sure would like to do better." And that's what I heard. The message I heard out there was, "I want to do better. I want better for me. I want better in total around me." That may not be a community or societal mindset yet, but it's at very least a family mindset. So, I want better in my household, some of which they can control, some of which they can't. So I walked away hopeful. I walked away with something that said to me, these are young people that aspire to something. And whether that's a better tomorrow or a much better life in general, I can't speak for them, but they aspire to something. So let's capture that. Let's hold on to that. Let's give them that. Let's not. Again, people aren't disposable. Look at those individuals and say, how can we create a structure that better supports your aspiration? And again, even if that aspiration is just, I don't want to be back here.
Okay. Well, with that, what about then, let's sort of fast forward trajectory of somebody's life who maybe was incarcerated or got involved in drugs and alcohol at a younger age. Now, later in life, and viewers watching this either themselves have been that person or they are family members, a father, a mother, a sibling. Now this person in need needs to go to a detox. And currently, that's not here. And there was a recent effort to make that happen at Poplar Hill, which actually I was a former inmate there for 42 years ago. And so that had some promise, but the bigger deal is, the promise that can there be a medical facility that's sort of like you're discriminating against people that have a substance use disorder, that you can't provide a detox. So to not put you on a spot, but I guess I know in a sense I am.
There has to be.
We need it.
So I think there's a couple things that we clearly need that we don't have. There's a lot that we have, and a lot that we should be very proud of.
Like the Hudson Center?
Like Hudson Health? Yeah, absolutely. Yep. Like Hudson Health, like some of our long-term community recovery houses that are integrated right into our neighborhoods, which, stoke a lot of fear. But any neighborhood in Salisbury who lives near one, has one in them, knows them, has taken the time to communicate and to get to know them, knows there's no need to fear. They are assets. They really, truly are. And even if that asset it comes with a little discomfort, like, oh my goodness, there's a bunch of people who could choose to go back to abusing drugs, who could, as a result, make some bad decisions. The risk is there, but the risk is there regardless in our neighborhoods. It's everywhere. So let's acknowledge that you are helping people recover and be right there in a neighborhood, right there as a part of something, and you're part of the support system because you live near it. So I think a lot of good has come from those. People in around like Newton Street in Camden, people on North Division Street in Newtown, they will tell you they are assets. They are assets. Detox. Critical. We have this COAT team, right? The city and the county jointly fund a COAT team that our county health department and sheriff's office co-manage, and awesome program. And so, they're going to people who are in that moment of decision making. Am I going to keep on with what I'm doing, or am I going to choose recovery? And that point is critical. And so we've got paid staff out there doing that work, and then we don't have anywhere to take them.
But then there is a safe station emerging that actually the Recovery Resource Center is.
Recovery Resource Center is a safe station,
yes.
Or will be,
yeah,
right?
Will be in a formal way.
And the city is hoping to make our fire stations and police station formally designated safe stations as well. But after that, you've got to get somebody into detox before you can get them into even short-term recovery programs.
Right.
And that transition, so I think two things that are missing are, one, a detox facility. I recognize that some hospitals get into that business. People have to understand, and this is frustrating for all of us, I think, but people have to understand that PRMC is part of the Maryland healthcare system. Maryland's healthcare regulatory environment is unique in America. It is not that's not necessarily a good thing. Not that all of the rest of America's healthcare system is great, but Maryland's is unique. In addition to that, PRMC is a nonprofit organization. While that doesn't mean that they don't make money, I mean, that money is reinvested into the organization, not dividends paid to shareholders, but it does limit some of what they are capable of doing because they are not sitting on oodles of cash that they are able to reinvest. So you're looking at an organization that could host a detox facility that is challenged in getting there. I think in principle they like it, but is challenged in getting there. You got the county applying for a grant from the state saying, yes, we want to do it. And then the details didn't link up, some issues. The one bidder withdrew. I don't know all the details there, but clearly didn't work. But we can't give up. We can't give up because, as you pointed out, that is one of the things we need. The second thing that I think is absolutely critical is I think we need to develop a guardian angel program here, a shepherd program where people like the COAT workers, like the COAT participants, are able to carry beyond that initial interaction and actually guide all the way through the process into detox, out of detox, into short-term recovery, out of short-term recovery, be responsible for and be an advocate for, and usually somebody who is in recovery themselves, somebody who has been there, a peer who has experienced it, but is also in a position in life where they can be an advocate for and a shepherd to the person who is in that moment of early transition and early choice.
So you sound like you're familiar that you've seen programs like that, or of programs where in other parts of the country.
Yes.
Or in other communities.
Yeah, and I got to give credit to Laura Mitchell, a former city councilwoman in Salisbury, our council vice president for a while before moving to Montgomery County. Her son was in recovery. She was very open about what she saw, what she worked on, what her family dealt with, and she
educated you in a sense.
She did. She was an early educator and exposed me to things that I needed to know that I didn't know I needed to know.
Okay. Well, speaking of that, then we were talking earlier about more to your personal point of view, and that family that have been impacted by substance use disorder directly or indirectly, and just how, again, brains are hijacked and families are hijacked and hostage by the sort of residual effects of addiction. And so do you care to share any about that and what that means in terms of hopefulness for recovery and that type of thing?
Yeah, so I think it's become almost cliche for people to say that everybody in America knows somebody who's battling with addiction or in recovery, right? It doesn't make it any less true. It may be cliche, but it's not false. So I grew up in a household where there wasn't the presence of addiction. My brother and sister haven't battled with it. My grandparents didn't battle with it. My parents. So I didn't know what I didn't know. And like I said, Laura Mitchell was helpful in educating me. But my wife's family has battled with addiction. She's been very vocal about that, and I've learned a lot not only from her, but also from her family members, what it can be like, and what the impacts can be, what the second and third order effects can be, and how this is not a challenge of youth, right? This isn't youthful indiscretion. This isn't a phase. No, this is a gripping, ingrained mental health-based issue that people will battle their entire lives and must fight, and there must be support systems to be there to help them. And those support systems, there are models that exist. And I think, again, we're getting better about creating those and better about funding and supporting those. But Liz, my wife, has talked frequently about what her family has gone through, and I've learned a lot from her and a lot from her family about what it can do to a family, and but also how you get healthier, and how a family can grow stronger, remain together, remain united. Whether I've seen it with parents. I've seen it with siblings. I think it's just there's no doubt that it can rip families apart. There's no doubt, but it also can unite in a lot of ways. I've watched her family come closer and closer together through the challenges that they've gone through, and that gives me a lot of hope.
Okay, yeah, and you're really describing the process of addiction and the process of recovery. That it's a progression downhill and it's a progression uphill, and it's a messy work. There's not a straight line, as we know. We're actually running out of time here, but I wondered if there was anything you specifically wanted to, as we're wrapping up, say to the viewers of this show about your commitment as the mayor and as a person, as a community member as well, to this issue and the support for addiction recovery and as a whole.
Well, I think we frequently right now in Wycomico County and Salisbury have the good fortune of being able to walk around with our chests puffed out and pat ourselves on the back. 3 consecutive years of declining opioid overdoses. So we get that opportunity, right? It could lull us into a false sense of security.
Yes.
And I want to encourage us not to get there. So I'm hopeful that some things on the horizon are going to help keep it at the forefront of our minds. And I think that is the most important thing that we can do as a community, is to talk about the challenge of addiction, some of the early pitfalls with drugs and alcohol, and the process of recovery, and keep funding and supporting those things. And that message is to elected officials, to keep funding and supporting those recovery tools. But there's some things on the horizon. You've seen Talbot and Dorchester County with their Go Purple efforts. You're going to see that effort here in Wycomico.
Can you describe what Go Purple for people that don't know that? Because that's about Chris Herron's.
That's right. So the Going Purple effort is like many, recognizing that branding and identity can help market and can help say, so the color purple in that case has flooded those communities to show support for recovery efforts. And so September this year will be the first recovery month during our Going Purple efforts here. I believe Sheriff Mike Lewis has agreed to chair those efforts. And so we're going to be talking about the process of recovery, experiences, real world, conversations about what I've gone through, what you've gone through, what our community's gone through, what our neighborhood, what my household's gone through. We're going to have those conversations out in the open. So the more we talk about it, the more people are willing to talk about what they're experiencing, what they need, what their challenges, and then the more likely it is that we can apply resources to the problem. Now, that doesn't public education and talking about it doesn't reduce the responsibility, I think, of government officials to come up with real solutions. And so we've been learning a lot from the Cities Thrive Coalition. We were one of the first 100 cities in America to join the Cities Thrive Coalition, started by First Lady Shirlene McRae of New York City after the NYC Thrive. They've been working hard to get mental health resources, first responder, first line mental health resources into the hands of trained staff. We are working hard with PRMC to actually add medical education in Salisbury to train mental health professionals right here in this community in order to keep them here. So we're working hard to take big steps forward, and I think that's important. And that paired with the dialogue, that paired with the openness, that this is not a secret, that this is not something to be ashamed of, that this is something to discuss, I think is the only way we're going to continue that positive trajectory.
Wow. That is optimistic, but it is going to still be a messy journey, though.
Well, you're right that it just as recovery is not a clean, straight line, neither will our process be or our progress be. But I am optimistic. I really am.
Okay, I want to thank you, Jake, for being here today and sharing some very powerful truths and points of views and your leadership.
Well, Perry, it's my honor. This is a great forum, and I really appreciate the opportunity to talk about this critical topic.
Okay. Well, I want to thank our viewers for watching another episode of Recovery Today. I encourage you to know that recovery is a process. It's not an event, but it is also a very treatable, evidence-based approaches, multiple paths of recovery as well. And also be reminded that you might also see this on a YouTube channel, and certainly share this and get the word out. And again, thank you for watching.